everybody was standing, the staff were standing outside of the clinic. They were looking for us. And I remember their lab coats were not very clean. The patients were laying on the mattresses and there were no sheets. I needed somebody that something that I could hold on, that I thought I could fix. I couldn't imagine fixing this place. And we walked to the schoolyard, and the teachers, we met the teachers over there, and they brought this little boy to me. And Brian was there. And Muryneza is 9 then, and he had these pustular sores all over his arms and his legs, and he was scratching, and his grandmother later told me that they itched so bad that he would get a piece of lava rock, and he would scratch his arms with the lava rock until they bled. And on the back of his leg, he had a huge open ulcer. It was deep, and it was about that big. It was big. And I'm a surgeon, and I'm thinking, I know how to treat chronic ulcers. I can do that, and all I need is some soap and water, and to get people to agree to clean that wound every day. And I taught Emmanuel. He's a healthcare worker. He's not an A3 or an A2. He's a healthcare worker. And I taught Emmanuel to clean wounds. And we brought up 2 jerry cans of water. It's the only way we get water, clean water. We gave this little boy a shower. Emmanuel did, washed him all over. And then we started cleaning that wound. And I was concerned because he'd been born in the Congo. Both of his parents had died in a refugee camp in the Congo. I was concerned about the possibility of HIV/AIDS. And the wound clearly started healing. It started looking better and better. And the last day I was here, we went over to the hospital. And that was the day that we got the report that the HIV was negative. And the wound had closed that day enough so we didn't need to put a dressing on it. I still don't know what the underlying skin disease is, and I can't find anybody that does. But he was the boy that gave me hope.